Well, hey, and welcome to another episode of The Compass. I'm here with Dr. Brad Robison, and we are creating a resource called The Compass Guidance for Your Journey. And we have a good topic to talk about today, which is centered around mood regulation, depression, bipolar diagnosis. And Dr. Robison, give us a breakdown. Why is this such an important topic, especially in 2022, 2023?
Yes. Well, it's an important topic for a lot of reasons. I mean, we're seeing a ton of difficulties with um, mood regulation, and I don't know. I mean, I think with COVID, post COVID, all of that, there's certainly a lot of talk out there about the impact that that's had on kids, on families, on adults. I mean,
Hmm.
on all of us in
Yeah.
terms of some of the isolation, and we're definitely coming out of that. I feel like, um, but we are seeing a lot of moody kids and adults, let's say, uh, you know, um, and so that's a part of what I think why we had talked about maybe covering this topic, and to cover mood and mood regulation in general is very, very broad. But one of the things that I wanted to at least kind of mention in this format, so that people can be thinking about, is how do they navigate, how do they journey through a process, and the starting point a lot of times is figuring out what's going on.
Yeah.
And these days in pop psychology lingo, which doesn't always match with actual clinical diagnosis, but these days in pop psychology lingo, a lot of things are labeled. Oh well, that's bipolar disorder, or that's just kind of any ups and downs of mood, or
Yep.
um, and bipolar disorder really is a very specific diagnosis, and most of the things that I see in kids, adolescents, and to some extent even in adults at this point, where there's a lot of moodiness,
Yeah.
is not bipolar disorder.
Yeah.
And so I thought that would be something to touch base on for families and individuals kind of going through this season of recovering from COVID, moving into the holidays. Certainly lots of ups and downs of mood.
Yeah.
And I thought we would just maybe kind of cover that spectrum a bit.
No, I think that that's great because I was even thinking this week, what do you do whenever you have a patient that comes in that's been diagnosed, for example, with bipolar, but maybe it is a mood regulation situation? How often do you see that? How prevalent is that? What are your key points you're looking for to say, yeah, I think that was a misdiagnosis? And then what would be some of the ramifications if they'd been taking medicine for bipolar and they didn't need it?
Yeah. Yeah, it's a real issue where I see it quite frequently, to be honest. I mean, where I have somebody coming in, a kid coming in who has either been labeled with bipolar disorder, or the family's concerned. Well, gosh, did they have bipolar disorder? And um, a lot of times it's not. And the things that I'm really looking at are the vast majority of the reason that kids are referred, kids and adolescents, I'm kind of lumping them all together, with mood difficulties, is because that they are having significant problems with mood regulation.
Mm.
But it's more in the moment. It's like, through the course of the day, their moods are good, and then they react to situations, and they become really emotionally reactive. um, and that requires a look, definitely, because it that kind of emotion regulation difficulties can be causing functional impairment. And that's the key starting point of sorting any of this out, is you're really looking at, is it causing ongoing functional impairment for the kid, for the family,
Yeah.
those sort of things. And so if it's truly causing functional impairment, then yes, it definitely needs to be looked at, but it's still probably not bipolar disorder, there are a number of other things that are much more likely. And let me jump to bipolar disorder, and then we'll come back
Yeah.
to that
That's
that
good.
that
That's a good
stuff.
way to do that. Yeah.
Um, so like the bipolar disorder, like a lot of things these days, we tend to see things in a spectrum, but still bipolar disorder in its classic form, even in kids, and yes, it's harder to sort out in kids,
Hmm.
but in its classic form, you're really talking about a distinct neurobiological shift from baseline mood. And
Hmm.
you really need to be seeing a pattern of several days to a week of elevated euphoric
Yeah.
mood. When we're talking clinical euphoria, we're not talking about, oh, I got a puppy and I'm excited, or I got a new car as a teenager and I'm excited. We're talking about something that's starting to raise the attention of family and friends around, going, okay, wait a minute,
Hmm.
that's like not them. It's, now the individual experience in it may still feel like, oh, this is great,
Hmm.
but people around them are starting to go, something's
Yeah.
off here. This is
Yeah.
well above normal, and it's sustained for several days to a week.
Yeah.
Uh, it's that kind of elevation in mood that we're talking about that starts to really raise the question of, is this a mania? Another telltale sign in kids of true childhood mania is, you know, truly staying up all night without sleep. Now, every
Mhm.
parent has had some experience with that. And almost every parent that I talk to, when I ask about sleep patterns with kids that are having various behavioral or emotional difficulties, they'll be like, oh, yeah, they don't sleep. Sleep is such a hard thing. Oh, yeah, they don't sleep at all. But then when you start actually questioning
Yeah.
them, they're talking about, well, they have trouble falling asleep, sometimes
Yeah.
for a couple of hours. But once they fall asleep, they're sleeping, 5, 6, 7, 8 hours. It's just they have trouble falling asleep. With a truly manic kid, the family's like, oh no, like
Yeah.
seriously, like, we've had to take shifts to stay up with them because they haven't slept for the last 3 days.
Yeah.
Literally. Oh, okay. Now, it's just a different order of magnitude. And now we're starting to talk about this is probably biologically based
Yeah.
mania. Um, and then you get the other aspects of it in terms of level of impulsivity, giddy, silly, behaviors that are, giddy, silly by itself doesn't make the diagnosis. But if you take the other things I've talked about, and then you
With
see
that, yeah.
with that, you see a child or an adolescent who's just, over the top silly, in completely out of character places, then you begin to put all that together and you're starting to think this is really truly a manic episode. And then the mania will last several days to a week, sometimes longer, because it can be harder to calm down. And then they may have long periods of time, days, weeks, months,
Hmm.
of euthymic, baseline moods. Now, they may have some moodiness. They may have normal behavior problems that every kid would have during that normal mood phase. And then they may go through another mania, or they may go through a depressed episode where they're, again, now we're talking about sustained several days to a week, really withdrawn, really flat affects, just blunted mood, flat facial features, no emotional spark, that sort of thing. Um, and those are classic kinds of ways of sorting that out.
Yeah.
There's mixed features and different things like that. But at least I think that makes the point that when we're talking about someone who's moody, it's probably not bipolar disorder unless you're really seeing those distinct mood
Yeah.
cycles or episodes.
Yeah. And I think that it's an interesting topic. And one of the reasons that I think I've discovered why there's a misdiagnosis oftentimes for bipolar is because of the way often insurance companies work. If they can get a diagnosis for something, then they're able to come back and that is able to be stimulated by that insurance coverage. What have you seen as some
Yeah.
of the reasons, and even maybe piggyback on how you guys process the whole insurance conversation?
Right. Yeah. Yeah, that's definitely true. I mean, over the years, we've seen that nationally. I mean, it's been something that has been recognized as a problem nationally, where, as the pendulum went from, we were really significantly probably underdiagnosing bipolar disorder in children and adolescents, to where we were probably overdiagnosing the disorder. Um, and the national experts, the DSM-5 committee, recognized some of that, and included a diagnostic category called disruptive mood dysregulation disorder.
Okay.
Um, to try to, at least, whether or not that's been successful nationally or not, I don't know, but it's certainly, I think it's been a good thing. It's tried to acknowledge the fact that there are kids out there, and I definitely see those kids who have a persistent irritable mood, a persistent problem with emotion regulation where they have a very reactive mood,
Mhm.
but really don't have bipolar disorder, are not likely to develop bipolar disorder. In fact, they may be more likely to develop depression or an underlying anxiety disorder as they get older.
Mhm.
And so that DMDD diagnosis has helped. And yeah, I mean, the insurance, I mean, I get it. I mean, we want to be able to, when there is genuine clinical impairment,
Right.
okay, when there is genuine functional impairment. Now that, when there is genuine functional impairment, where we do need to be able to intervene, parents want to be able to have that covered if possible with insurance. Now, we manage that and have our whole career. I mean, we don't take third party payer insurance here at our practice, and haven't for our whole career for various reasons. I realize in some ways that puts some bit of a burden on families, but our experience over the last 30 years are that, one, insurance companies don't pay all that well for any of these mental health diagnoses, especially long term.
Yeah.
Um, and the insurance then kind of tries to dictate
Yeah.
you can do this many sessions for this and this for this. And, they kind of try to, so we just, avoid that altogether. But yes, those are some real issues for understanding mood disorders and why things get labeled. I want to jump back to like I said, bipolar disorder, but I
Yeah.
want to go back to just emotion regulation difficulties, and how to navigate that as parents.
Yeah.
And I guess I don't know that I intended to, but we have obviously kind of directed this more towards children and adolescents. So let me talk about how to navigate that as parents, just emotion regulation difficulties in general. Emotion regulation difficulties in kids are really common these days. I think there's probably a lot of factors there. I think the pace of our culture probably is a part of it.
Mhm.
And I think, so how to navigate that, the starting point is, I mean, I hate to say it because it sounds so cliche, but there's so much truth to it too, that, it starts with, at home, with that family time, with the really, having, slowing down, spending time together as a family, modeling, every day, modeling times of calming and self-regulation of the pace and the intensity of the busyness of the day, especially for young kids. I'm talking about here. I think sometimes parents may, in the busyness of our day as parents, we can easily kind of forget how important those daily rhythms are
Yeah.
to helping a young child's body,
Yep.
literally brain, learn to self-regulate and down-regulate. And when kids don't have that daily rhythms, it has repercussions in terms of their brain development and those sort of things.
I think the pace of the culture is very difficult. I was just thinking about my own family who has younger kids and there's older kids, and this kid's at basketball and this kid's at cheerleading, and those daily rhythms are
Yeah,
really hard. And some of the internal discussions that we've had would be like, hey, these kids during the summertime, man, that's great. They're able to, and then some of that moodiness comes out a little bit into the school year. I'm sure that's probably what you see as well. But something that, as you were talking, I started thinking about, well, what about like teenagers? They're 12 and 13, they're starting to go through puberty. Like, how much of that is a part of mood regulation
yeah,
versus a biological disposition you've seen when they were 6 or 7?
yes. Um, it really is. You know, I was just talking with a family about this just the other day, with a teenager, and talking about the fact that, I think in our culture we feel like, the moody teenager is just the norm, and there is some truth to that to some extent, but it's not it's not that every teenager is just automatically moody and irritable. Some of it is biologic temperament, but some of it is just the skills that they've developed or not developed over time, in terms of regulating their emotions,
Mhm.
effectively communicating, effective interpersonal communication. By the time you're an adolescent, I mean, we're all learning and honing those skills. But if you haven't picked up some of that by the time you're an adolescent, you're going to be moody and irritable because you're
Mhm.
not very effective at, you know, conflict resolution and interpersonal communication with your peers, with teachers, with your parents. And of course, I mean, I don't expect teenagers to have mastered all of that, but if they've at least got a foundation to build on,
Yeah.
then it doesn't have to be a lot of moodiness and mood irritability, with those kids. Um, I think part of the theme of that, Tyler, and I think, I don't know, we may have bitten off more than we can chew here in terms of like the
I think we're doing
the,
good.
the breadth of this, but to just give people a little bit of a thread through it again, back to just mood regulation in general, is we all have our own temperament with regard to that.
Mhm.
Biology, not talking about a diagnosis, we're just talking about our own kind of biologic wiring. Um, but there is a huge amount of like just family interactions, learning how to help children self-regulate, learning what is important in those processes at 2, 4, 7,
Yeah.
that age range, that lays the foundation for healthy emotion regulation for the rest of their life,
Yeah.
really. Those are key things. And so finding ways to do that and navigate that is a challenge for families. And I know, in our compass, we try to kind of outline for families kind of the idea of, okay, your family's journey through something like mood regulation difficulties or bipolar disorder, how to navigate. I guess we've touched on a little bit, but maybe not enough. We'll keep trying with that. But then also like skills. What are skills that you can teach? How do you navigate this as a family on your own? Um, well, part of it is you continue to really work on skills building with kids.
Yeah.
You work on, helping kids learn how to identify emotions, very early on, use, parts language is what I often call it. It's the more technical terms would be mentalizing language, but it's parts language. Like, oh well, okay, Johnny, I can see that there's this part of you, that's struggling with this or feeling this way. With our son, we use him a lot, Josh, and I use my kids as examples. Josh is a great guy. He's a great dad. He's doing very, very well. But temperamentally, he was more emotionally intense, and we would talk about when he was little. We would, we talk about Grumpy Bear and Buzzy Bee. It's like, oh, I
Mhm.
can see that Grumpy Bear coming out. Oh boy, that Buzzy Bee. His kind of hyper excited part.
Mhm.
So like using parts language, identifying emotions, recognizing and helping a child recognize the inner dialogue, the
Yeah.
inner battle of emotions, and gosh, that starts at a very young age.
Yeah.
And so being able to have those conversations and help kids with that really does lay the groundwork, so that those are some specific kinds of skills that families can work on with their kids that really do help with emotion regulation.
It sounds like the whole family has to be in on it together
Yeah.
too.
Oh
Yeah.
yeah. Yeah,
Which I
absolutely.
think is really important. When you're talking about mood regulation, are there medicinal treatments or this is something you shy away from? And
Mhm.
sort of first line would be, let's work on some things inside the home. How do you manage that?
Yeah, yeah. Yeah, we're really talking the you know support within the home, the skills building, developing those kind of emotion regulation skills, mentalizing, and skills. Those really are the first line treatments all the way through, in terms of
Mhm.
all the way through the age spectrum and all the way through the severity spectrum, if
Mhm.
that makes sense. like
Yeah.
like it's all the way through the age spectrum. It's still skills building, emotion regulation, all of that. And then it's through the severity spectrum, from a normal moody 4-year old all the way through to a severe bipolar 9-year old or 16-year old. Your first interventions need to be support, skills building, around those kind of mentalizing parts language for the individual and the whole family. Yeah, and then medications may be for the more severe, functionally impaired, maybe more clearly bipolar disorder, which would be more of the rarer case. But then yes, sometimes then you might have to look at medications that might help. And as we've talked on this, on the compass before, medicines definitely have their downside and shouldn't be used
Yeah.
lightly. But they really, you're weighing. A lot of times people look at weighing the risks and benefits of medicines as if not using medicines has no risk.
Yeah.
And that's not the case. I mean, with these more severe cases, um, if their mood regulation is severely impaired enough because of an underlying bipolar disorder or other things, and it is causing real functional impairment in school, it is causing real issues with safety because of level of impulsivity, whether it's aggressive acting out and trying to hurt others, whether
Mhm.
it's aggressive acting out that puts themselves at risk. One young man years ago, I remember, I mean, with bipolar disorder, one of the ones that the parents were like, no, literally, like, we've had to take shifts to
Mhm.
stay up with him because he has not slept in 3 days. And we found him on a second-story roof, and fortunately they got to him before he fell off. But the, you know, the reality is, in those situations, the very real risk of the child being injured because their judgment is so
Mhm.
impaired, that they're literally just running out into traffic, or climbing up on 2 and 3 story buildings in this manic state. I mean, I've had that with with patients. So you have to look at, to not treat with medications, there are severe risks.
Yeah.
And then you start going, okay, well, let's look at the risks of the
If we
medicines.
don't.
Do the risks, weigh out the risk benefit ratio. So yes, some individuals really do need to be on mood stabilizing
Yeah.
medications to help with this.
I love that distinction that you just made then because it helps me process it much differently than I have before. I'm wondering if you can take a second and tell a patient or two's success story of how you walk them through this, because I think one of the things that I love about your practice compared to a lot of other practices is you develop long-term meaningful therapeutic relationships where you're seeing the same patients for 20 years. And
Oh,
so what are some of those success stories of maybe they came in as a child and look at them as
yeah,
a high functioning adult today?
yeah. One that stands out to me immediately is a young man who I've worked with for several years, and I have to admit, and I think part of the reason he comes to mind is it's an example of how difficult it is to sort this out.
Yeah.
I'm certainly not saying that I get it right every time, but this is a young man who, man, when he was in elementary, his mother and I, his mom's a nurse. We talked through a lot of this. She's very, very good mom. And we worked through a lot of this. There was a strong family history on the dad's side with a bipolar disorder. And we were like, boy, this really does seem to meet that criteria of bipolar disorder in elementary. Um, and some severe functional impairment. We ended up getting him on medications. We were able to be successful keeping him safe, keeping him out of the hospital, and allowing him to get through high school, elementary and high school with a relatively intact self-esteem, which is key,
Hmm.
right? You got to find the niche, keep self-esteem intact. And as he got older, he got better and better and more stable. And eventually he wanted to go into the military. And we were eventually able to successfully, through the last couple of years of high school, taper him off of medications. And then I followed him for a while after high school, and he did well and was able to join the military and move on very successfully with life. And, in retrospect now, you can debate that, but in my mind, that wasn't bipolar disorder. What was it? We have, was it the disruptive mood dysregulation disorder? Was it? I mean, there was a family history of bipolar disorder. The functional impairment was real. It wasn't like that we just willy-nilly said, oh, he's got bipolar disorder in a 20-minute visit and put him on medicines and
Hmm.
send him on his way. I mean, we spent a lot of time with him, a lot of time with his mom, a lot of time talking with school. The functional impairment of his mood regulation difficulties when he was younger was very, very real and very significant. But he did, in fact, get much, much better.
Yeah.
And that's something that I tell parents all the time. It's a good case example of what I tell parents all the time. If you look at the data for mood disorders in kids, they really do occur and they are significant. And kids that are very, very moody, I mean, depending on the studies you look at, it's significant. 20% of those kids may really go on to develop severe bipolar disorder as adults, or more. Maybe some studies, even up to 50%, may have some type of a mood disorder diagnosis as adults, major depression, bipolar disorder, that sort of thing. But that also means, even if you look at like the 50% number, that
Hmm.
means that 50% of them don't.
Yeah.
you, you
Yeah.
know
Yeah.
and so you have to really, I always say time is our best diagnostic tool, and you have to really keep all of that in mind. Another another bookend story is a young man that I've worked with for years now with bipolar disorder, who does have bipolar disorder as an adult, and I've worked with him since he was a young teenager, and gosh, we've worked together for years. He's a parent, and married and has kids, runs a business very successfully. Now he's still on medications, and when he's if things aren't right with his medicine, sometimes he can still go through a depressed episode or a bit of a manic episode. But we've learned to manage it together over time, and he's very successful. But he does, he's the example of somebody that's like, yeah, this really is a chronic, biologically based mental illness that he's had to learn how to manage and stay on top of. And like I said, he's been very successful. I think if I remember correctly, he only had one, maybe two hospitalizations when he was younger, late teens. We kind of got through the early 20s with a little bit too much alcohol use, which is, by the way, parents and kids and everybody out there, you know, that's a, I mean, you know, alcohol use in late teens and early 20s is a normative experience. I mean, everybody just kind of normalizes it. And for the vast majority of individuals, they do okay. They do okay. But for the kids that I work with that have some concern about underlying mood disorders, alcohol is
Right.
just putting gas on a fire. I mean,
It's destructive. Yeah.
it's destructive in terms of the level of how much that adds to the dysregulation of their mood. And so this young man is an example of that. I didn't know, his parents and I didn't know for sure if we were going to get through the late teens and early 20s, because he was out drinking with his buddies all the time, and his buddies kind of outgrew it and didn't have a lot of functional impairment from their alcohol use, and he wasn't using any more than his buddies were, but it was very dysregulating for him. And so his emotions were all over the place, and at times suicidal and all of that. And when we finally kind of got through that, and he began to realize, wait a minute, this is killing me. This is, literally, this is killing me. I can't do this. And then, he got off the alcohol, stabilized on medicines, and, is very, very functional, great guy, does great.
What's that time like when someone who's dealing with mood dysregulation or bipolar disorder is in your office and you're creating the sacred space between you and them?
Yeah, that's a theme that we really do. We always come back to, and it's hard to define on a video like this. It's hard to define, folks, but that is such an important part of what we do. It's the therapeutic relationship that creates, we just build relationship that's safe first and foremost, that we just build a genuine connection, that people know that we're here, that we care, that we're on the other end of the phone when they call and they're in crisis. It's not, a 1-800 number. It's somebody that knows them, that's working through it with them. And so it's safe and genuine relationship. And then, as we create that space, as we hold that space together, then things happen in that space. I mean, God shows up, hope shows up, love, joy, peace, patience, which are, the manifestations of the divine, that is transformative. And that's what turns it into sacred space. I mean, I can't do it. I don't have healing in a bottle. I can't, but I can do the best I can do at being genuine in relationship and creating safety for people. And the thing about that is, it's a little different than our topic today, but it's worth mentioning. It's not just that I create safety. They create safety too. They have their part of it too. I couldn't do this if it wasn't for the fact that patients and families really buy in and are very respectful of this relationship and of my time and of my, they're very respectful of me and my time, and they don't intrude, and they create safety for me as I create safety for them.
Yeah.
And that's part of what allows that space to truly become sacred, it's,
I love it. And I think that's one of the hallmarks of why you have so many success stories. As I was thinking about um, disruptive mood, or mood dysregulation, bipolar disorder, are there different classifications and subcategories in each of those diagnoses? And are they worth mentioning, I guess, would be the other part.
There are. I mean, again, my with regard to diagnosis, part of my main take-home message for families and individuals watching this is, a lot of things aren't bipolar disorder. We don't have a good label for a lot of those things that aren't bipolar disorder. I mean, maybe it's trauma, maybe it's PTSD, maybe it's disruptive mood dysregulation disorder, anxiety disorders. But the mood disorders, you're looking at in kids that disruptive mood dysregulation disorder is persistent irritable moods, is the brief kind of hallmark feature. Persistent irritable reactive moods is the hallmark feature. And those kids don't necessarily go on to develop bipolar disorder. Some of them
Mhm.
do. Some of them go on to develop like major depression as adolescents and young adults. And some of them don't have any mood disorders at all as they get older. And then you've got the bipolar 1 and bipolar 2. Bipolar 1 is the more classic major depressed episode, manic episode type bipolar disorder. Bipolar 2 is major depressed episode and hypomanic episode, which, it's like sort of manic, but not quite as bad, in
Mhm. Mhm.
brief. And yes, there really is something to those spectrum diagnoses. I get frustrated with my field sometimes from the standpoint that we put, labels on things that are, that don't really differences without distinction kind of thing. It's
Yeah,
like
yeah.
apples and oranges. But there is something to those. You do have to kind of pay attention. Is this truly bipolar 1? Is this bipolar 2? Is this DMDD? Is this just major depression? You do have to take some time to really sort that out.
If a parent is watching this and they're like, "Man, it might be DMDD that my child's dealing with. I
Mhm.
tried to call. I'm 9 months out." What's the best steps for parent management system before they can come in for a meeting or a clinical appointment?
Yeah. I mean, a couple of things. The pediatricians will hate me saying this in some ways, but there are a lot of really, really good pediatricians out there that can help parents, navigate some of this in those initial phases. And then, the other thing that I would say too is seeing a good, I mean, if it's at a point where you're feeling like, man, we've got to get some kind of clinical help here, seeing a good therapist is always a good place to start, because even if it is more severe bipolar disorder, yes, at some point we need to have a conversation about medicines, but we're still going to talk about
Yeah.
emotion regulation skills. We're still going to talk about, sorting through family dynamics to, maintain safety. How do we handle this when they're manic? And so a good therapist can do that. And even if you're not seeing a therapist, don't discount your expertise in a sense as a
Yeah.
parent. Spend some time really thinking through with your child when they're calm, not when they're
Yeah.
escalated, but when
Yeah.
they're
Yeah.
calm. Time thinking through with the child, identifying emotions and talking about what works, create little um, comfort boxes, comfort items, things that they can use and go to when they know that they're emotionally escalated, that helps them calm down, squishy balls and coloring books and,
Mm.
age appropriate stuff, obviously, but things like that would be some things to work on.
No, that's great. Was there anything else about either bipolar or DMDD that you felt like we should mention today?
I don't think so. I mean, I think those are the main things. Like I said, I feel like we've covered a really broad
Yeah.
category with just barely hitting the surface of a lot of things. But I hope that does give people a little feel for that whole spectrum of mood regulation difficulties with kids, and gives them a little bit of a handle on, okay, I think we've got this. This is just kind of a phase that they're going through, or I do need to call and get some professional help. Yeah.
I think it was great, very informative. If you guys are watching right now, thank you so much for tuning in. You can go over to bradrobisonmd.com, click on the compass. We have a whole ton of resources there for you. If you're interested in scheduling an appointment, you can call 573-334-7055. Thank you for joining us again on this episode of The Compass.